A lot of the time in clinic, I have clients come in and asking, Regan, how do I deal with the after effect of having filler? What do I do when I get home? What's normal? What's not normal? So I thought we'd break it down just in case it's your first time having filler, you're going to a new practitioner, or you're not even thinking about getting filler, you're just interested to know. So after you have your filler done, it is really, really normal for them to kind of hurt a little bit, feel quite tight, be swollen, be bruised. You have had a needle just jabbed in your face. So you may swell, you may bruise. Also, the swelling is from trauma from the needle, but also from the lidocaine used in the filler, because majority of fillers are cross-linked with lidocaine. However, that said, if you're ever unsure of anything, always message your practitioner. But things your practitioner will kind of advise you to do when you go home would be kind of the standard procedure of don't lie all the way flat down, make sure you're sitting up a little bit, try and avoid any sort of caffeine, any alcohol for a couple of days after, because you should have avoided it before your appointment as well if you were following your pre-care. Other things you can do is you can apply a cool compress. This could be like a cool bit of kitchen towel, or it could be, say, an ice pack wrapped in kitchen towel, because you don't want to put the ice directly on your face. Make sure it's wrapped in something. Eat and drink anything pineapple related, because the enzymes in pineapple are absolutely fantastic for bruising and swelling. Take your antihistamines. You can also apply arnica cream or take arnica tablets. That massively helps as well. It's important to know that when you get your lip filler done, or any area of your face filled with a hyaluronic acid based filler, your healing time is 2 to 4 weeks. Now, we always say the majority of your swelling and bruising is gone within a couple of days, but when your practitioner tells you that your healing time could be 2 to 4 weeks, remember that you may not be one of the lucky ones that heals within a couple of days. You may take that full amount of time. So make sure, obviously, if there are any issues, message your practitioner. But if you get, say, day 10 and you're still feeling a little bit swollen, you may just need the full 2 to 4 weeks to heal. Now, also remember that everyone's experience is different. So just because you may not have swelled or bruised, your friend might. And a lot of the time, swelling and bruising is not down to the practitioner. If you are deficient in iron, in B12, if you've had any caffeine, any sort of alcohol prior to your appointment, you're going to bruise, you're going to swell. So don't ever think that if you do get bruising that it's down to a bad practitioner. I wholeheartedly, that is not the case. If you are having a needle jabbed in and out of your tissues, you most likely will bruise. You probably will swell, but just make sure you follow your aftercare as recommended by your practitioner to get the most gorgeous results possible.